Hello everyone. We all understand the importance of oral health, but how many of us can actually correlate it with its importance to our overall health? We at Purexa, being an oral wellness brand, not just care about your teeth or your oral health. We do care instead, along with the oral health, your complete overall health, which is so important because if you're able to maintain a good hygiene of your teeth, your overall health gets a lot better. This is so important that Purexa has added another tagline to its logo, which says, oral health is the gateway to overall health. So in continuation with our endeavors to help our customers understand the importance of oral health along with your overall health and the impact it makes on each other, we have introduced a series of discussions with top medical practitioners of India who would talk about how the oral health gets affected because of the problems and the medical conditions we face, and also how these medical conditions in turn can lead to problems in oral health. So oral health and overall health have a direct correlation, and Purexa, through the series of these discussions with the top medical practitioners, is here to explain all this in this forthcoming series. I'm sure you would get enlightened because of that. To kickstart this endeavor, who better than one of the finest physicians of the country who would talk about the importance of diabetes and oral health. We have one of the top physicians whose blessings has always been with us since the inception of our careers. I am very honored to welcome Dr. G.S. Grewal today, and we talk about how diabetes, one of the most common diseases in the country, directly impacts the oral health of the person. We welcome you, sir.
Namaskar, good evening. I'm Dr. G.S. Grewal, consultant at the Fortis Escorts Hospital. It's a pleasure to be here with you talking about oral hygiene and its effect on the entire body.
We all understand that India is the sugar capital of the world. So please, just let us know, please enlighten us on how diabetes affect the oral health of the individual and also vice versa.
Diabetes in India is an epidemic. With the population of diabetics in India and also the pre-diabetics who are not yet diagnosed but have the fear and the possibility of complications of diabetes. So therefore, diabetes by itself does not kill or damage, but its complications do. And the role of oral hygiene in management of diabetes is not yet fully understood. The moment you take in a bite of food, your digestion starts from the mouth. There are very important hormones in the saliva that start breaking up the food while you're chewing it, and before you swallow, 25 to 30% of the digestion has already happened. When in diabetes, because of poor circulation and repeated infections of the gums and collection of food between the teeth and the gums, it makes the individual prone to get small infections in the mouth. Situation. What happens is that the brain does not get proper message to regulate the insulin in the body, and that itself can lead to poor diabetes control.
Guess it's like a vicious cycle now between diabetes and the oral hygiene.
It is a vicious cycle. One leads to the other. So poor control leads to infection, and infection leads to increased complications of diabetes. So the oral hygiene is not just meant for good smiles, but it is the gatekeeper of good health. So maintaining good hygiene is your starting point of looking after all your diseases and especially diabetes.
Does that imply that infection transfers can happen easily because of diabetes?
In diabetes, small infections like gum infections or tooth infections can spread to the body because of the lowered resistance of the patient, and infections from there can spread to the knees, to the ears, and to the gut. So, a small little pus in the gums can become the nidus of infections all over the body.
Yes, I think I'm understanding what you're saying, and I think that means that people suffering from diabetes must use the right armamentarium in their oral hygiene maintenance, especially battery brushes or good probiotic anti-cavity toothpastes or even good antioxidant mouthwashes, so that the chances of infections are minimum rather than just using the plain outdated manjan.
The traditional, manjans from the trees and charcoal and various other things used are not proving to be good in diabetics. It is important, for example, if you are using distillery water, you are using ORS as an alternate to the famous ganne ka juice in jaundice, is because you prevent infections. Similarly, today it is available to every one of you. There are good products that are useful in helping you maintain your oral hygiene, including brushes which are meant to be less harmful to the gums and to the teeth, especially in diabetics, to prevent small injuries. There are good mouthwashes which can be useful for enhancing the digestive capacity of the individual. And in diabetics, there is a displacement of normal bacterial flora. So, restoration of the bacterial flora is very important for the immunity of the patient, especially in diabetics.
So thank you very much, Dr. G.S. Grewal, for all your love, support, blessings, and on top of it, such valuable information of how diabetes, one of the most common medical problems, directly getting associated with the oral health of a person. Thank you very much, sir.
Thank you.